Well, a proposed change to Medicaid would have greatly impacted a Metro family. The Oklahoma Healthcare Authority considered changing a rule regarding family members who provide private duty nursing for their children. Ashley Zeno's son, Joey, has Creutzfeldt syndrome, which requires round-the-clock care. Ashley, a licensed nurse, along with another nurse, helps to provide the care for her son.
I was also his nurse for part of his shifts. Doing that allowed me to be able to stay home and take care of him because, again, he can't go to a daycare. So I can't work outside of the home with having him in my home. I'm stuck. So by being allowed to work as his nurse for part of the shifts, it meets the family income.
And since the Oklahoman published the story in March, the Oklahoma Healthcare Authority decided it would not vote for the change. And joining me now is health reporter Jacqueline Cosgrove. Thank you so much for being here.
No problem. Thanks for having me.
Of course. Now, Jacqueline, what was Ashley Zeno's reaction when she heard the news?
She was really happy. She was very surprised. I got a call on Tuesday saying from the spokeswoman at the Healthcare Authority saying that they weren't going to vote on it. And I actually just sent her a text message because I assumed she knew, and she was like, "What?" And so she was really quite excited. But she also wanted to point out that she doesn't plan on stopping with her advocacy, and I think she's going to be invited to be on a member panel with the Healthcare Authority to kind of voice more of her opinions.
Oh, wow. Wow, so she's definitely involved.
Yes, very much so.
That's neat. Now, how many Oklahomans help provide nursing care for their relatives?
So about 200 Medicaid recipients are approved for private duty nursing care. So that means they either have a private duty nurse coming into their home who they don't know, or they might have a family member. There are about 14 Medicaid members who get private duty nursing care from a family member, and Ashley Zeno is one of them.
Wow. Oh my goodness. So it impacts quite a few.
Yeah, it could. I mean, it's something that they were, she was saying that there aren't enough nurses, and Joey's not a child that she can take to a daycare because of the special needs he has. So she doesn't necessarily want to work from home, but she has to because there aren't enough nurses to take care of her son. Because she's a nurse, she could go work at a hospital or something and make more money than she makes at home. But right. She's kind of stuck in her situation. Yeah,
that's interesting. Now, what was the reasoning behind the proposed rule change, and what changed their mind?
The Healthcare Authority every year updates a mass amount of rules. In their meeting this week, the rule changes were about 2.5 inches thick in paper. That's how many rules they were updating. Wow. So it's a lengthy process they do once a year. So this was just one of the many rules that they were changing. And the Healthcare Authority, they have a lot of experts on staff who study the issues and, make reports about the issues. So they have studied this issue quite a bit, and they've studied other states and what they were doing and what private insurance was doing. They just decided that this was what they thought was an appropriate action to take. But then, like I said, on Tuesday when I found out, I was told that they decided that they're going to spend the next year studying the private duty nursing system as a whole rather than just looking at this one rule. And so, Ashley Zeno will be one of the people helping with that, and they'll have other experts come in, and medical experts and child advocacy experts looking at, like I said, the whole system rather than just this one rule.
Yeah. Wow. Well, what a great ending to this story. Obviously, it sounds like she's relieved.
Absolutely.
That's great. That's great. Well, you can find out more about the story in Friday's Oklahoman or online at newsok.com. Thank you so much.
Thank you.